Fatima, from a poor village in eastern Afghanistan, suffered 2 miscarriages in her early 20s, but when she got pregnant again, she could not afford medical care. Like most Afghan women, she went into labor at home with no skilled assistance.
I had pains for 2 days. Then the baby's head came out, but the shoulder got stuck. No one could do anything. Eventually, 4 people picked up my bed and carried me to the hospital. It took 3 hours.
Fatima's life was saved, but by the time she got proper care, a hole had formed between her birth canal and bladder, a condition known as obstetric fistula. She constantly smelled of urine.
My life was awful. I had to stay in another room apart from my family. It made me so sad.
Fistula is common in Afghanistan, where motherhood is more dangerous than almost anywhere else in the world. 1 out of 8 women's deaths is related to pregnancy and childbirth. There are many reasons: early and frequent childbearing, and a lack of midwives, accessible health facilities, decent roads, and affordable transport. Poverty, conflict, and conservative attitudes also contribute. Most cases of fistula can be repaired, but treatment was not an option in Afghanistan until last year. Now there is a surgery unit at Kabul's Malala Maternity Hospital, supported by UNFPA, the UN Population Fund. The news is starting to get around. In Ghazni province, Fatima and her husband, Mohammed, learned about the new facility. They decided she should go to Kabul, even though they had no money.
We sold our land to pay for the journey. Then bandits robbed us on the way. We had to return home and borrow money. I'm so worried about this operation. What if my wife dies? Who will take care of our children?
Hospital director Dr. Nasreen Oryakil led the team that operated on Fatima. The procedure was relatively simple, lasting less than an hour, and the surgeon was relieved.
This operation was very successful. Dye test is negative. This is a good achievement when we are operate patient. Dye is not coming from the hole. Dye test is negative, and we are very happy now, and we have hope.
Muhammad Ali was also relieved.
I am so grateful that my wife is okay.
Staff at Malala have performed more than 72 fistula operations this year, giving women like Fatima a new chance to lead productive lives. There's no charge for the surgery or hospital stay. Surgeons from other provinces are being trained here, and a series of TV and radio ads is making more women with fistula aware of the services. Fistula surgery is also now available in the provincial hospital in Badakhshan, which has the highest maternal mortality in Afghanistan. One beneficiary suffered from fistula for 20 years. In the few months since her surgery, Basbebe has gone from pariah to community leader, chosen by her neighbors to head the village women's council.
I'm doing very well. I can walk around, visit other families, and go to other villages.
UNFPA is also helping the Afghan government mount a campaign to make motherhood safer and prevent fistula. It aims to end early marriage and encourage wider use of health services by promoting the value of women's lives and well-being. Fatima, who got married at 13, now has a chance to start over.
I'll be so happy to go home.
This report was prepared by William Ryan and Mark Westhoff for the United Nations.